Butter and margarine, often used liberally in cooking, baking, or as spreads, may seem like everyday staples, but for individuals with high blood pressure, they represent a significant and often underestimated dietary hazard. Both butter and many types of margarine are high in saturated fats, which have profound effects on arterial health, blood pressure regulation, and long-term cardiovascular risk. While they provide flavor and texture, their habitual consumption can silently accelerate hypertension and damage the heart and blood vessels over time. Saturated fats contribute directly to arterial stiffness, one of the central mechanisms by which blood pressure rises. When arteries lose elasticity, they are less able to expand and contract with each heartbeat, causing the heart to work harder to pump blood. For someone already managing hypertension, this added strain significantly increases cardiovascular risk. The arteries effectively become rigid pipes, unable to buffer the high pressure of circulating blood, which accelerates damage to the vascular walls and promotes the formation of atherosclerotic plaques. Over time, this contributes to an increased risk of heart attack, stroke, and chronic kidney disease. Butter and margarine are also calorie-dense, which contributes to weight gain when consumed frequently. Excess body weight, particularly abdominal obesity, is closely associated with higher blood pressure. Fat accumulation around vital organs promotes inflammation, insulin resistance, and activation of the sympathetic nervous system, all of which further elevate blood pressure. In this way, saturated fats from butter or margarine not only stiffen arteries directly, but also indirectly worsen hypertension by contributing to metabolic dysfunction and obesity. Margarine, especially the more processed varieties, carries additional hidden dangers. Many contain partially hydrogenated oils, which are sources of trans fats, compounds even more harmful than saturated fats. Trans fats accelerate arterial plaque formation, increase systemic inflammation, and reduce endothelial function, further compromising vascular flexibility. The combination of saturated and trans fats creates a potent, compounding effect on blood pressure, arterial health, and long-term cardiovascular risk. Even small, repeated amounts of these fats over days, weeks, and months can silently erode vascular integrity. Butter and margarine also interact negatively with other dietary patterns. They are often consumed alongside high-sodium foods, processed meats, refined breads, and sugary items, amplifying the stress on the cardiovascular system. The combination of high saturated fat, excess sodium, and refined carbohydrates creates a perfect storm for hypertension. Arteries stiffen, blood pressure rises, and heart workload increases, while protective mechanisms like nitric oxide-mediated vasodilation become impaired. Habitual patterns like these quietly accelerate cardiovascular aging, often without any immediate symptoms. Portion size and habitual use exacerbate the problem. Many people spread butter on bread, add it to cooking, or use margarine liberally in baking without realizing the cumulative amount of saturated fats they consume each day. Unlike obvious sources of sodium, the damaging effects of saturated fats accumulate silently, making it easy for someone to consume harmful levels over time without immediate warning signs. The long-term consequence is progressive arterial stiffening, chronic elevation of blood pressure, and an increased likelihood of severe cardiovascular events in the future. Even moderate use of butter or margarine can become dangerous when part of a broader diet high in saturated and trans fats. Combined with frequent consumption of cheese, fatty meats, fried foods, or packaged snacks, the cumulative intake of unhealthy fats can accelerate hypertension, impair endothelial function, and reduce arterial elasticity. Over years, this pattern contributes to structural changes in the heart, including left ventricular hypertrophy, which increases the risk of heart failure and arrhythmias. Finally, the subtlety of the risk makes butter and margarine particularly insidious. Unlike foods that immediately spike blood pressure through sodium overload, the effects of saturated fats are gradual and cumulative. Arterial stiffness increases slowly, metabolic dysfunction develops silently, and the heart and vascular system experience chronic strain before any noticeable symptoms appear. By the time visible consequences, such as severe hypertension, swelling, or cardiovascular events occur, significant damage may already have taken place. In conclusion, butter and margarine, especially those high in saturated and trans fats, are far more than simple culinary staples. Their habitual consumption promotes arterial stiffening, increases blood pressure, contributes to metabolic dysfunction, and accelerates long-term cardiovascular damage. For people managing hypertension, these fats are a silent but potent threat, capable of undermining heart and vascular health over time. Vigilance, portion control, and limiting use, or replacing with healthier unsaturated fat alternatives, is essential to prevent cumulative vascular damage and protect long-term cardiovascular well-being.